This is the story of 9-year-old boy who was brought with head injury in deep coma state, was considered dead initially and later saved by heroic miraculous surgery.
Doctor, in this video you are telling, the boy was declared dead by other doctors. Can you explain what was the problem?
Thank you very much. What you have heard in the YouTube video is yes, exactly correct. This boy was brought in unconscious state to the hospital where I was working. It was Sunday evening, and they have come from North Kerala after traveling 5 to 6 hours long journey, carrying this child. He was, I think, around 8 or 9 year old. What happened was it was Sunday. They are Christians. They went to church for prayer. And as the parents were praying, children, what they do, they go out and they meet other children and start playing. So while playing hide and seek, they were climbing the staircase and this boy fell down. Now, after falling, suddenly he became unconscious. And people got panic and they called the parents. And after some time, they sprinkled water on his face and then he regained his consciousness. He was almost appearing normal. He was talking, he was responding, and he was looking here and there. Then everybody was happy, but somebody suggested to show to doctor. So it was a tier one sorry, it was a small town where general practitioners were practicing. So so they took the boy to that doctor, and he examined and told at that time he was fully conscious, and he advised them keep him under observation, and if there is any vomiting, so you can take him to higher centers for getting any CT scan or further treatment. So as soon as they left the clinic, he had 3 4 times vomiting. So naturally parents will get panic. So they decided to come to take him to bigger center. Now from there, the nearest center is a 5 hours journey. Ours was a specialized neurosurgery unit. They wanted to bring everybody knows in North Kerala, but it was far. However, they took the ambulance and they immediately started. At that time, he was conscious. So what happened during the journey as they, traveling, the child was vomiting and there was no other way to treat him. They have to reach the hospital at any cost. So the child became slowly drowsy, and and he lapsed into unconscious state. Just before arrival to the hospital, he was fully unconscious, comatose, and there was no limb movement. And like that, they lifted and brought to the emergency department of the hospital. Now, what happened? He was made to lie on a stretcher, and the duty doctors, trainee doctors, general surgery trainee doctors, they are pursuing a MS course. They were called to see the child. So the doctor, when they came, the child was immobile, not having breathing, and when he examined pupil were fully dilated. So the doctor thought he's gone. Yes. So if you first instance, it appears like that when the patient is not breathing and pulse is almost feeble, not palpable, and doctor is also under tremendous stress. So what is this I can do now? So he told sister, child is already dead, so nothing has to be done. So they were waiting like that. So next, what happens? Whenever you bring a unconscious patient and brought dead, unconscious patient and brought dead. The procedure next thing is they have to inform to the nearby police, and then the post-mortem has to be done to find out the cause of death. Now he being a small boy, parents were very nervous and sitting outside and crying. What else they can do? They were crying and crying, and that is the story of this child actually. Okay, he was about to be seen by police taking the statement from the parents, and then he will be moved to as a dead body to the mortuary of forensic medicine. There they will do autopsy. Now, being a Sunday, every Sunday I used to do evening rounds in that hospital for my neurosurgery patient. Normally, I visit the ward. There are multiple entries through other routes. This time, suddenly, what happened, I do not know. I got, feeling that I should go through this emergency route. Means on the way, you will see the emergency ward and then go to the my neurosurgery ward. So when I was crossing the emergency ward, I entered ward. One patient was lying without any relative attendant, just like that young boy. I got excited. What is this? Let me go and check. So when I checked, this boy was young fellow, 9 years, and I asked sister on duty, staff nurse on duty. So she told me patient was brought dead. So there is nothing is there. Oh my goodness! Has anybody has told neurosurgery or consultant here? No, doctor has seen and he was talking. I do not know anything about that. Okay, then let me check. So I just opened this one. Pupil was completely dilated, both side 6 millimeter. That means brain is almost injured severely. Next, there was no limb movement. It was pura flaccid, totally flaccid, and there was hardly any breathing. Absolutely, if you were seeing just like that, you cannot see the breathing. And his pulse was not palpable. That is why I checked the carotid pulsation here. And I could feel some pulsation here. Some pulsation was there. So then I touched his head like this. So on the left side, there was a big swelling under the, it was covered with hair. There was a big swelling and it was a soft. So then I came to know there is a big injury here and there is a blood accumulated under the scalp. So just like that, I asked sister, give me one big syringe, 20 cc syringe, and a big needle, 18 gauge needle. So what I did, I cleaned with sterilium and I inserted my needle and aspirated. As I aspirated, free blood came. 20 ml of blood I got. I was looking at this blood like this. So normally what we do, aspirated blood. So we will throw that. I thought it was looking like normal blood. Why to waste it? Anyhow, he is gone case. So I injected into his that IV line was there. Into that injected 20 ml. Then I again aspirated. Again 20 ml. Like that 6 time I aspirated. Nearly 120 ml of blood I could collect from, aspirate from this scalp swelling. Then the scalp swelling reduced. I do not know what to do now. There is this one. Before the aspiration, what I did, I forgot to tell you. I called the sister and I inserted the breathing tube, endotracheal tube into his windpipe, and I told her to give this one air ventilation. Now, after injecting 120 ml, Suddenly, I got a temptation to get one CT scan. So immediately I called the parents. See, I am doing like this. So there is no chance, but let me check what to do. So I pushed him myself and took him to the CT scan and got immediately CT scan. For our surprise, there was a big clot inside the head, means deep to the skull, and there was a fracture here. Probably he has fallen there, and there was a big clot, and it is called extradural hematoma. This clot is not inside the brain. Outside the brain, there is a covering deep to the bone. It is the clot is between the covering and the bone. That means brain per se was normal. That is why immediately after the immediately after the fall, patient was conscious and he regained consciousness. Suddenly he lost consciousness because of impact, that shock. Then he regained after 5 minutes. Then he slowly gone into unconscious state. So that we call a lucid interval, means the interval during which he regains consciousness, then slowly he will go into unconscious state. That is because slowly the blood start accumulating at the site of fracture. Now that might have happened. So that doctor was correct. Now what happened? Big clot. I called the relative, parents, father, and informed, see, there is a clot that requires removal. We do not know what is the outcome. But because he was all right few hours ago, and he is a very young boy, it is better to operate immediately and remove the clot. I told him. And from the CT scan room, I pushed him to the operation theater. It was Sunday. Operation theater means it is a cleaning day. There is no available ready operation theater. Some OT, ENT OT was there. It was kept like that. So I entered there, took him there, called the sister who was there, bring the instrument immediately. There was no anesthetist. I told one staff to call the anesthetist. And they will, Sunday, no, they will take their own time. It is correct. So what I did, I got the instrument and shaved his head, gave injection here, straight incision, and opened this and made a big hole and removed the bone. There was a massive clot, thick clot, cake like clot was compressing the covering of the brain, and I was, you know, satisfied by the way I did it. Now, there was, no problem during that because the one person was, continuing his breathing and bleeding and all I controlled. Meanwhile, our anesthetist arrived and I told him to connect to the ventilator. So then, after waiting for some time, after controlling the bleeding and whatever required procedure to be done for this type of clot, I did, and I kept this place open. And then I closed the thing. And one thing was that I removed the pressure on the brain. That was my satisfaction. Now, from that stage, only thing we can do is shift him to ICU and keep him on ventilator. Now, the pupil was like that only, but the opposite side pupil, it has become half the size of the previous before surgery. That means some activity might be there. The pressure we have removed. Now, over 12 hours, the opposite side pupil became normal and the same side, operation side, become slightly less. And then, after 3 days, both side pupil became normal. It started reacting slowly. And after 1 week, child started moving limbs. And believe me, third week he was conscious. And after 2 months, he got discharged, walking discharged. A patient, a child who was about to be sent to mortuary for autopsy, post-mortem examination, and after a FIR with the police, was bailed out from death, literally death. We would have done a grave mistake, injustice to the nature, because of our short-sightedness, impatience, and poor examination.
Doctor, that was too good. Then what happened to the patient?
See, this boy, improved, and after discharge, he came regularly for follow-up every monthly. And after few years, I left that institute and moved to another city. And after 15 years, his father called me and told, this my son has completed my graduation and he is waiting for job and he is perfectly normal, sir. So I am so grateful to you. I am going to send you uh, a gift which is coffee powder which has grown in our garden. I told, thank you very much. It is a great news for me for adventurous surgery done those days. It was a miraculous. It is pure God's intervention, divine intervention, because at that time my total mind trajectory changed. Instead of going from that route, I entered this one. So it was unintentional. It was some external, some effect on my mind which has happened. So I told him, it is just super. It is just super.
It was really an inspiring story. Normally when one doctor declares death, another doctor rarely goes the dead person. Then what made you to go and see that patient?
See, you are correct that normally in a institute or big hospital, there will be a hierarchy. Means a person who see junior person, once they see the patient and then they come to one diagnosis, the senior, unless there is some surgical intervention and all, they don't go and cross check. Now the same thing happened. Fortunately, it was unintentional call. So I have not received a call, and I do not know anything about that patient. But I happened to go through that emergency route, and I saw that patient. Then I went. Nobody has informed me. Nobody has called me. That is why it is not that I am going and rechecking a dead patient. The patient was lying on the stretcher. He was immobile. I saw the patient. I am having that habit. Whenever such patients are there lying, I used to go and see. And that helped this boy. And more important is the parents, because they were literally shattered. I just cannot believe this. Myself, I cannot believe, because this was something which was unexplained till date.
That was just superb. His family will be eternally grateful to you. I am sure you also may be feeling great joy.
Parents will be always grateful to the doctor, because, see, it is a gift of life. Now, you know that quote, no? Saving one life means saving one generation. Saving one life means saving one generation. And a person, a boy who was unconscious on deathbed and today is living normal life, means what a great achievement and what a great happiness. and I am always thrilled. The whole purpose of becoming my neurosurgeon was that purpose. Can I save this type of patient? It was, you know, in 1985, took that. I took that oath. Can I save this type of head injury patient? And even if I save one patient, it was a great pleasure for me. And I'm just feeling super. Thank you very much for asking this question. I am sure you liked this video. Kindly write your comments and subscribe and forward to your friends. Thank you very much.